People are always scared to like interact with pregnant patients or say, oh my God, you're pregnant, I can't do anything. And everyone freezes up.
Good morning, good afternoon, good evening, wherever you may be tuning in from. Today, I have such a special guest, one of my favorite practices in healthcare. Today, we have Dr. Singh with us. She is actually going to be a nearly like world-class leader. She is recognized at the local, regional, national levels for patient safety, and she has been practicing in OB-GYN for quite some time. She's earned her bachelor's at psychobiology from UCLA, and she's also received her Doctor of Medicine degree from Chicago Medicine School. And so I wore my Chicago Bears sweater, even though I don't know anything about the NFL. But excuse me for the casual attire, but I was just like, okay, maybe this is appropriate because we do have a lot of Chicago graduates on this podcast too. And so, yeah, so before completing her residency in OB-GYN, she's actually been at the USC and LA County Women's and Children's Hospital when it was around, and then she later completed an executive master's degree in USC's Marshall School of Business. And so essentially, this strengthened her leadership in healthcare systems to allow to lead other professionals in quality improvement and patient safety. And so we already know she's a patient safety expert. She served as a chair of medical staff performance improvement at TMMC, which is known as Torrance Memorial Medical Center. And she serves as the co-chair of patient safety and quality improvement at the American College of Obstetrics and Gynecology, California. And she's also recognized as a delegate for the National Patient Safety Team. And so she's very, very passionate about advancing patient safety and health equity. And so, what more of a better guest to have on the pod today? Thank you so much for coming, Dr. Singh. Really appreciate
Thanks, Caitlin.
it. Yeah, so we'll just hop right into the first question because we have four questions instead of three today because Dr. Singh is just a wonderful, very personable woman. And so, my first question to you is pregnant patients have historically been underrepresented, especially in clinical trials, due to many meds being used in pregnancy, but that lacks strong evidence for their usage. And so, what motivated you to bring a pregnancy focused clinical study to Torrance? And how do you think this is going to impact patient care in our community specifically?
Thank you, Caitlin, for that question. Yeah, people are always scared to like interact with pregnant patients or say, oh my God, you're pregnant, I can't do anything. And everyone freezes up.
Mhm.
And, we can't do that. We're patients with other medical conditions. We can get appendicitis, we can get sick, we can get the flu, and we still deserve treatment, right? So that's what we want to um, encouraged not to be afraid of taking care of pregnant patients. And what really motivated me to help bring, like one of the first clinical studies to a community hospital was that most of patient care is taken care of at the community level.
Mhm.
So we love our academics team. We trained at academics. We need them so much, but then we graduate and we go then serve our communities that we end up being physicians at or
Exactly.
treating. So the community level setting is a majority of patient care in this country. And it was so exciting when I got this opportunity to bring in Torrance Memorial patients to be able to be involved in this national study on preeclampsia. We won't go into the details for that, but it was really important to have that base because if you only have a certain kind of patients in research studies, then that study can be biased. So if you have more diversity in the population and in these studies, and especially at the community level and setting that may not have the resources that other settings have,
Right.
you're bringing in more information that's needed that can help in managing and treating these patients.
I definitely agree with you on that. I'm just a part of clinical research team in general. I think that especially when you're trying to make like a protocol, for example, or really trying to justify why your site, for example, at Torrance Memorial might be appropriate to conduct their study. And I'm assuming this is a sponsor study if it's recognized at the national level.
Yeah, we were luckily have an affiliation with Cedars-Sinai Hospital.
I see.
And so that affiliation really helped strengthen. Cedars recognized the need. I would give a shout out to Dr. Sarah Kilpatrick. She's the chair of the department there, and really saw the need to have community hospitals, community patients involved in these studies. And so we learned a lot.
Yes, I definitely agree with that. So what I was saying about using a sponsor and then integrating it into community health, especially when you're doing like literature reviews and once the study has been closed, monitored, and it's been complete, I feel like it's very enriching to actually have such a diverse population to actually be applicable to very similarly structured communities like Torrance Memorial. And just the safety net urban population in general. I know that Torrance Memorial is a non-profit hospital, but we still deal with patients from county hospitals like Harbor, UCLA, and Carson. And so I think it's very important to be able to recognize exactly what you just said, just bringing more diversity, inclusion of pregnant women in studies, as well as treating them like any other patient that presents with however degree of illness or condition that they present with. And so that actually is integrated into my next question. And so now more so leaning towards patient safety and your expertise. So through your work in patient safety and quality improvement at Torrance Memorial and many other involvements too at the regional and national level, as from your biography, I know you work with interdisciplinary teams, and it's almost you have to shift your mindset from now thinking in like a very tunnel vision space, like how you would as a specialist, to a broader systems level thinking. And so, how would you describe your leadership style when you're guiding other professionals? Like you're a professional, but you're guiding other professionals. How badass is that? Towards shared goals in patient care.
Oh, interdisciplinary teams are badass, Caitlin. So
Mhm.
they are, we all have our bubbles, we all have our expertise, but it really strengthens and improves patient outcomes
Mhm.
and care plans when it's interdisciplinary. As we know, patients are becoming more complex in care, and especially pregnant patients are becoming more high risk with multiple medical conditions that we do need other disciplines involved in. And when you have that different gaze and the different views and everyone looking with their lens, it really strengthens the outcome and really benefits the patient. When you center the patient and everyone else supports that, it really benefits everybody. And it's not unidirectional, it's bidirectional. We learn from the patient, I learn from my other interdisciplinary team members, and in when I lead like safety site visits and things, the listening is like a key portion of how you're going to go with the treatment plan. And
Right.
so I love listening to people outside of my specialty,
Mhm.
and to see what we can do to make things better.
So, how would you describe your leadership style in that sense? So for example, for me, like my leadership style, I would say with a lot of the volunteers I work with at a different program for undergrad students, I would say like I like to establish a culture that's very inclusive, obviously, but more so casual, and so that we could get to know each other on a personal level. We have coffee here and there, and then we jump right into like specific parts of like a meeting, just balancing the casual and professional equally. But what would you say your leadership style is more towards?
Yeah, similarly, is to establish that psychological safety. So
Mm.
you want people to be able to speak freely what's on their mind and not be afraid to say something, because that's what brings up patient safety events. You have to be able to speak freely and prevent any other things that may happen in the system.
Right.
So I usually same try to just build the trust because if you have a multidisciplinary team, we all may come in with our own biases
Mhm.
on what another team member may be like. So you want to build trust and then build that safety, that psychological safety, so we can kind of minimize some of that biases and bring in that inclusion of everyone's thoughts and ideas.
I see. So that does make sense. And just a side note, I just had a question about a very particular part of patient safety that I've recognized myself just as a volunteer in general. I guess like when it comes to very sedentary things such as a CNA watching a patient who's high fall risk and is sort of agitated and has to be almost strapped to their bedside where they can't get up and they have more, I guess, more sensitive alarms set for them. I guess, how do you navigate those very passive roles where you're just watching someone in terms of patient safety?
Oh, that it's really quite active too. I mean, in the sense that you're watching and passive, it's still, you're always on alert. Like it's saying, like a physician, if you're on call, oh, it was like a light day, I didn't get calls, but you have to be on all the time.
Mm-hmm.
So it's kind of like it may appear to be like passive, but you're actually always on in the background on high alert for these. So, like, I can give an example of, say, the fire department or police department.
That's
There
true.
may be no crimes or fires happening, but you know what? They're ready to get in the car and get to where they need to if something happens.
I
So that's like an example I can give. Yeah.
Okay, that makes sense. And so I was also going to more so talk about your OB-GYN background too, and also pretty much tie into quality improvement in care as well. And so many women do deal with daily challenges, especially when, as an OB-GYN, you almost grow up with your patients. So you see them when they're super young, maybe 20s, 30s, and then they're trying to get pregnant. They do get pregnant, you help deliver their children, and then now their children are out of the nest and they are dealing with all these conditions like hormonal imbalances, like irregular cycles, or spotting or mood changes, fatigue, polycystic ovary syndrome, endometriosis, whatever. And they have to get their bone density, they have to get the mammogram done, they have to get all these checkpoints done, and you're almost monitoring their health. But now that they're in a different life stage, you get to see that too and really treat them too. So, in your experience, how can clinicians just better recognize and support patients whose symptoms are almost sometimes dismissed and misunderstood too?
Oh, 100%. And the what you just described about the whole life cycle of a patient, that is so dear to my heart, because that's exactly what has happened in my practice, is from, the teenager years to, seeing them go to college, and then, having children and the whole cycle. And then even the children that I've delivered going to college
I
and
know.
everything, it is
Yeah.
amazing. So that is so, I can't describe that feeling. It is such a service to be able to do that
Right.
and be involved in that cycle. But the symptoms in this, as the healthcare system becomes more complex, and so many more burdens are put upon like physicians and doctors, it can be so easy to be dismissive of patients coming in and be misunderstood. And we really need to work on that on a systems level, on how to be able to balance that, and bringing more awareness to that. And absolutely, we see it in every sector. But how not, and also being a patient yourself, doctors become patients too. You're like, oh my gosh. And then you
That's
see,
so
I know, look how busy they are. Oh, I don't want to bother them. And oh, maybe it's not that important. And so it goes both ways, as like a doctor can be a patient, and it's hard, and we do need to bring that in. I would love to start bringing awareness and how to advocate for health starting in high school, to teach this to students starting at high school, and because as they go to college, that's how they're going to start advocating for their health.
right.
And so my personal passion would be to start with how to advocate and learn about health, evidence-based care, and starting at the high school level, because then that can help you transition into college, and then college, and you're adulting, learning how to adult, and then from there, as you choose your careers and your paths, you're able to just strengthen upon that foundation, then pass it on to the next generation.
That is very well, beautifully said, and I very much support that cause too, that vision you have, especially when you're in college. You're most likely, maybe you're going to be commuting, maybe you're not, but let's say that you are displaced from your family home, and then something happens. Like for example, I've broken so many fingers playing sports in college, just intramural, not even D1 or anything, like just casually broken my finger, and then I had to just go through all the scheduling and the surgery stuff on my own. And I was like, maybe I should have just been a bit more educated on how insurance works. Even something as simple as HMO versus PPO, stuff like that, where in high school it's not necessarily taught in like regular education curriculums. And so I very much agree with advocating, especially when you're transitioning. I think that is something that I wish I was educated more on instead of being forced to learn it when when the condition is happening or
Yeah, like there's usually economics or finance or things like that. High school introduce, like, like 2 to 3 weeks, really basic stuff on, student health and, yes, health insurance, things like that. And at college is the first time you're learning and utilizing the medical system, as you just said, sometimes. And, you're going in cold turkey, and it's nice to just kind of have that preview. And then even in college, I think there should be an orientation on
yes.
access to medical services and medical care. So that's my little mentor hat coming on for you. So just I just to really elevate and bring that up, starting education process early.
I definitely agree. And I think, sorry, I don't know if we're rabbit holing too much, but this is just like sparking my I guess like insights on this. But yeah, and also finding like your tolerance levels for example, underage drinking. I know that that's a very big thing, and just being aware of environments that are going to be like that and have social pressures, just being more aware of just the harsh reality of undergraduate life where you might be pressured to do things that are illegal, or you might not know necessarily like specific laws and regulations surrounding those consequences. And so just being, yeah, just more wary of all of those things that happen early on in college and that could really affect your long-term health
Yeah.
overall. I'm just realizing as like a younger like 20s like person, I'm 22, and I'm just realizing that the decisions I make now are definitely going to impact the way I live at 60 or 70 or 80. And so I don't know why I'm just realizing this now, but that is even more so reason why we need workshops and orientations like that.
Yeah.
But this is my next question, more so OB-GYN, but I wanted to really talk about stigma. That is like one of the biggest topics that I actually express on this podcast. And so patients sometimes do face social stigma, especially around topics such as STDs, STIs, or contraceptive care, or just any reproductive health measures in general. And so that might not be celebrated in their culture, that might be rejected in their culture. And so, how can healthcare providers in the United States and in our community specifically just create a safer and more supportive environment so that patients can actually feel comfortable discussing these issues and seeking their care?
This is a perfect way to transition what we were just talking about, educating, right? So, college student health, this is a huge topic
Hmm.
with this, and where, for sexual education, sexual health care, contraception, so important in that setting. And that's where we can start learning to decrease that stigma, be openly talking about these issues. So, to not only educate ourselves, educate others, educate our partners, and protect each other. We're all here to like elevate and support each other and make sure we all stay healthy. And being able to openly talk about it, I think, uh, introducing it in college orientation and student health activities is really important to decrease that stigma and create that supportive environment to start early. And then as you transition in life to more adulthood and more adulthood, hopefully it passes generationally as we
Right.
pass it on. So,
I definitely, I really like that response that you just shared because I definitely do. A lot of people that I ask this question to, like even people my age, people older, people that aren't even in the healthcare sphere, they more so talk about the downstream interventions where a lot of beliefs are already pretty much drilled into your brain. Your neurons aren't as plastic or plasticity. There's neuronal plasticity involved when you are younger, and they sort of solidify more as you get older. That's why it's harder to learn new things, such as going to medical school versus 50 years old versus when you're 30 or 20 years old. And so, more so building off of that topic, I think it's very important to have upstream interventions, upstream of or I should say, like, would you say the adolescent years, the younger adult years, pretty much? That
oh, absolutely. Starting, like we said, from high school,
right,
as you're entering adulthood, and then whatever path that goes on after schooling,
right.
whether it may not be college, but you still have to know and be able to advocate for yourself. So I don't want to limit it just to college. I want anyone
Mhm.
to be able to advocate and have this education and start early.
I definitely agree as education as a tool to really provide that information and to make people more aware. And
And comfortable and comfortable.
comfortable, yes.
Yeah.
And just having a community to fall back on that are of people who are going through the same thing. And so that is pretty much my very last question. And just to go back to just what we were talking about earlier with patient safety, I guess for example, when women are feeling, I guess, like almost very hesitant to engage in their care. I don't know if you've had a patient like that where she might have been talking with you about just what was going on internally and how she felt with her symptoms, and that she felt just hesitant, and how you were able to help her open up as a female provider too, to make her feel more comfortable. How did you make her feel safe and comfortable in that space?
Yeah, and it depends, and this only comes with experience.
Right.
Is it may not be on the first visit, but you schedule the follow-up visit. So you're kind of just building that trust, right?
Mhm.
So if they've had mistrust of the healthcare system, you got to build that trust. And sometimes you just hit it off on the first visit. You're like, oh gosh, that was so gratifying that the patient trusted me. And then there may be some on the first visit, they're not there. Oh my gosh, let me see on the follow-up visit. And there may be some you may just not be the right fit, and they may need to see another physician with a different communication style. And it's okay to not take it personally, but to learn from it and stuff. So there's a lot of different permutations about how to build that trust. And it's okay. It's not a failure. It's just trying to find the right fit.
Mm.
So that's what I usually, and this is with experience, and you kind of on that first visit will ask open-ended questions, and you can sense if there's more going on, not, and just keeping it very comfortable, not pressuring the patient, letting them speak, and mainly listening. A lot of it is listening because they haven't been heard.
I want to like almost frame that quote. It's not about failure, it's about the right fit. I really like that. That is like one of the biggest takeaways I had from that answer. And I totally agree. I could very much tell that you're very experienced. And in this podcast alone, I feel very comfortable, even just sharing about my experiences with you. And so I don't really do that often in episodes, but thank you for making me feel that way. Um, even just in this conversation alone. And so, thank you so much for your time. This was an amazing conversation. And pretty much, I just want to do a quick summary of what this podcast is all about. So we are a series highlighting accomplishments, advice, and attitudes of changemakers advancing women's health in LA County. And so thank you so much, Dr. Singh, for joining us. This was amazing. Um,
Thanks for having me. Appreciate you and the generation that, we can spread the word. So there's has to be that intergenerational communication. So
exactly,
kudos to
exactly.
you.
Thank you, and we shall see you next time. Thank you.
Anytime, anytime. Thank you.